Hi there, I'm Dr. Bill Lawler. Good to have you here with me today. Some of you are patients in our practice in Alpine, Utah, chiropractic for kids and families. Some of you may be looking at this in some other venue or way. Good to be here with you. I'm going to do a video on how to raise healthy kids without drugs/medicines and a few other things. So, how do I get to be an expert on this? Basically, I've been at the parenting thing for 40 years and the grandparenting thing for 14 years. So 6 kids, 12 grandkids, that ought to give me some wisdom and knowledge and so forth. But I've also been a chiropractor for about 38 years, and my specialty has always been pediatric and kids and families. Our current practice, we see about 40% of all of the people that we see are ages 18 and under, and we have a whole bunch of little babies that come in here that are colicky and not happy, and talked about that in some other videos. We're going to talk about that a little bit in this one as well. So how do you raise healthy kids? One of the issues, first of all, is should a kid be born healthy or should a kid be born sick? I am totally of the philosophy that we should be born healthy. That's our natural birthright. Yes, there's genetic factors. Yes, there are other things that can happen in a minority of cases, and I don't mean to minimize those minority cases. They can be terrible and very difficult for parents. But we're going to talk about the percentages that are the more normal case. A child is meant to be born healthy. So we are going to take a look at how do you raise a healthy child, trusting the body more, doctors less, including chiropractors. You want to trust the body more. We have other workshops on similar topics. I love this video. We're not going to take time to watch it. If you want to look up Kid Natural video on medicine, it's hilarious. This little 10 or 11-year-old kid who talks about that drugs aren't good for you, and he kind of explains why. It's really, really good. So if you go to YouTube and punch that up, it's delightful. It's only about 2 minutes long. And there it goes. It was about to start. So, how did it all begin for me? Well, you can see in this picture, I love kids. I love talking to kids. And I'm still pretty much a kid, even though I'm way older than one. So I just always have enjoyed them and have enjoyed hanging out with them more than I do adults. In a family setting, I tend to migrate to where the kids are, unless they're jumping on a trampoline, than to the adults. So, way back in 1977, I went to my first chiropractic workshop that happened to be one on kids. I didn't know that ahead of time. My sister was working for a chiropractor in Waterville, Maine, of all places. And she said, hey, you gotta come to this workshop. And so I did. And he showed a baby that had colic, a toddler that had ear infections, and an older kid that had digestive issues. And I didn't know what he was doing because I'd never seen an adjustment before in my life, but I could tell that whatever he was doing, the kids liked it. It seemed to be helpful. And then I talked to the parents afterwards and to him, Dr. McCormick, and that was it. I was hooked. I said, okay, this is what I want to do. This is amazing. This is a way to help the body naturally, without drugs, without shots, without blood, without medicine. It all sounded awesome to me. So off we go. What can you do to help your child be healthy? How can you help your child when he or she is sick? First of all, you should have a whole bunch of stuff that you're doing to help your kid be healthy. Help them get enough sleep. Help them eat. 100% great is not very easy to do, but do as good as you can to help them eat as well as they can, and find out if they are lactose intolerant, gluten intolerant, whatever else intolerant, nightshades, etc. Because if they are, then you're going to cause them to be miserable if you force them to eat things that are bad for them. I have a 10-year-old granddaughter who is lactose intolerant, and she figured out somewhere between ages 3 to 5, you know, that ice cream, that milk, that whatever, it really wasn't worth it because of how her body reacted to it, so it just wasn't a good thing. So for her to be healthy, she needs to avoid that. You know, a brother, sister, whatever, may have no similar predilection or tendency, and therefore it's not the same thing. But how do you help them be healthy? Have a positive attitude about it. Don't over-reward them when they are sick, which we're going to talk about next. So if they do get sick, then don't make that be the time you pay the most attention to them, but pay attention to them and show them love when they are healthy and reward them more for being that. Help them when they're sick. Anyway, so now we're going to talk about a few sick things. Probably the biggest one is a fever. Should you freak out about a fever? Is a fever normal or is it not normal? Is it something you should be excited about or not? Basically, a fever is a good thing. If you want to purify water when you're out camping, you boil it. Fever raises the body's temperature. Let the body do its thing. That's what it's trying to help. It's trying to heal. It's trying to make it better. Number one of all these things is don't freak out about symptoms. If yes, they're lethargic, they're frothing at the mouth, they can't, are not unresponsive, then freak out. But other than that, don't freak out. Ear infection, not a big deal. Something you can treat naturally with olive oil and garlic. There's drops you can get at health food stores. Do a massage of the sinuses to help drain it out. Make them comfortable. Don't give them dairy stuff that's going to make it more mucousy. Do some natural things as opposed to freaking out. Get the antibiotics, get the tubes. Call DEFCON 2. Try to relax. Cold, sore throat issues can be treated very naturally. Honey and lemon is a great thing for the sore throat. Gargling with salt water if the child is older. Do natural, easy things instead of freaking out and doing all kinds of treatment that puts extra stuff in the body. You have a tummy ache? What should you do? You should chill. You should relax. See what they ate. See what they shouldn't have eaten. See that they're drinking enough water. It's a huge importance for kids to get enough water as well, which is usually basically half their body weight in ounces, whatever age they are. Okay, so if your child is sick, when should you go to the ER? When should you go to the family doctor? When should you see a family chiropractor? When should you do nothing but just chill? That's not an easy thing to figure out. My advice is go to number 4 first. Do nothing but observe, comfort, and love your child. Start with that. See what happens. Go beyond that. I have 6 kids. One that tended to have more issues than the others, and another one who never seemed to have issues. So when the one was in pain, we freaked out. When the other one, we said, okay, let's see what else is going on. There are times to panic. There's a lot of times not to panic. Western medicine thinks that you need to treat the effect more than the cause. The child is too hot, too cold. The blood pressure is too high, you lower it. If the stomach has acidity, you put something in to reduce that. Headache, you're going to get rid of that by putting pain killers on it. Too much energy, let's knock that down. Not happy enough, let's book that up. Going to kill the virus, kill the bacteria. It's all outside in, forcing from the outside. We advocate doing from the inside out. Helping body from the inside out. What can we do to help that child be more comfortable? What can we do to help make that child feel better emotionally and physically instead of, okay, what can we dump on top of them? So, quote from a book that I really like, Healing in the Mind by Bill Moyers, talking about the difference of Western doctors looking for clinical chemical abnormalities. Chinese doctors, on the other hand, try to work with the body, help the energy flow better, and to help from the inside out. Vitalism talks about that very thing. Chiropractic's major premise is there's universal intelligence connected to our own innate intelligence, which heals, regulates, controls the body. It's always happening, always there, always trying to heal, always trying to do its thing. So if we work with it as opposed to against it, have a much better chance of helping that body. Living organisms, self-determining, self-evolving, and self-sustaining. Okay, this is from a doctor named Dr. Lawrence Palevski. Actually, a few videos ago, I showed him in front of the Connecticut Congress testifying about vaccines. He's the one that actually developed this chart, and I really like it. So conventional pediatric practice is disease-centered. Holistic is, okay, let's see what's about this particular person. Crisis intervention, how about prevention? Reductionism, treat the effect, looking at the whole body. Practitioners of authority and practitioners of partner. I really try to foster a partner relationship here. I hopefully to everybody that comes in here and say, okay, you want a wellness picture? I'm one piece of that. I'm not the whole thing. I'm one piece of that. There's the nutrition piece, the exercise piece, the sleep piece, the other health professionals piece, all kinds of other things to do beyond just treating things. It's having an overall approach. Illness is bad, actually can be beneficial. It's a nuisance, can be a catalyst for change. Health is the absence of illness, that's not true. Suppress symptoms, how about let's find out why they're there. Eliminate symptoms, again, let's see why they're there. Magic bullet, let's evaluate contributing factors. Treatment, external remedies, quick fix, cure, treatment. Let's look at the whole overall body. I've had some teenage girls come into the office and they had a lot of stuff going on. A lot of it was anxiety related. A lot of it was new school, new place to be, new things happening. And that was really more the issue than the pain in the back and the tummy ache and whatever. So you need to look at the whole picture and see what's going on. All right, why should a child be checked by a chiropractor? Well, because what is it that controls the whole body? We know it's the brain, the nervous system. What have you done for your child's nervous system lately? What is the subluxation? Here it is. Vertebrae misaligned, causing pressure directly or indirectly on nerves, not allowing the body to express its full level of health and potential. We chiropractors from little babies do very gentle maneuvers and pressure to help that vertebrae get back into alignment, get pressure off of that nerve, help restore homeostasis, and help the body heal itself. So many babies come in here with colic, with constipation, with reflux, and the medical association is treating from the outside. We just try to help chill that little baby's body out. And I got a whole bunch of mothers that will tell you it was the greatest thing they ever did, and they're sleeping better. They're happier, they're pooping better, they're digesting better, they're not spitting up as much, and not because we did anything from the outside other than help that little body do better. Why do babies need to get adjusted? Because they got born. Huge trauma. 50% of all kids fall in the first year of life on their head. Crawling is huge. Learning how to walk, they fall a gazillion times. I did 2 different studies. One said toddlers fall somewhere between 20 to 40 times a day. Another one that actually falls 300 children, the parents actually observed, and the average was 17 times in an hour. So all that trauma in the spine, not going to be good for the baby, not going to be good for the toddler. They need to get checked. All right, when should a child get checked? If you use the Western medicine approach, you wait until there's a problem. If you use the Eastern vitalistic medicine approach, you look at how can we help this baby from day one. We have parents bring their children in with no symptoms just to get checked, see what we can do to help, and we can help that little body function better. I do have some handouts. Anybody that's interested can ask me for them. How to boost the immune system, how to strengthen your immunity nutritionally and other ways. Also have some natural remedies, an overall sheet that shows remedies for colds, for ear infections, for sinuses, for tummy aches, for all kinds of different things. I'd be happy to send that to you as well. So, my final thing, there it is my little family a couple of years ago at my daughter's wedding. We have some very happy kids and grandkids because we've done our best to follow this holistic pursuit, and it has paid off. So what I'm going to do today is the 12th of October, and I am willing to, anybody that will bring a child in over the next 2 weeks, so for the rest of October, can come in and get an evaluation at no charge. That will be on us, and we would love to help them out. Go to our website. You can set up your own appointment there, both as a new patient and as a recurring patient, if you do live near Alpine, Utah. If not, find a pediatric chiropractor. Go to a website called ICPA4kids.com. Find a pediatric chiropractor near you. We're supposed to be healthy, and there's a way to do it. There's a way to help your child be healthy without having to do all kinds of outside stuff. Now, I do, once again, empathize with those children that are afflicted in ways that are way above and beyond normal. And I still would try to add as much normalcy as possible to that. And I think love goes a long way. So thanks for listening. And if you have any questions, let us know. Happy to be of help. Talk to you soon.